Hi, it's Angie Settle with Your Health Done Right. I'm here today with Alice Lockman, who's one of the nurse practitioners at West Virginia Health Right, but she's also been previously a long-time volunteer. She works with Dr. Nick Cassis, a local endocrinologist, so she and he have been going to Health Right for many, many, many years. How long has it been, Alice?
Dr. Cassis started in about 83, 82.
Long time, actually.
And I started in 93.
Yeah, so we recently lost somebody very special to West Virginia Health Right, and that was our founding CEO, Patricia Holmes White. She passed away on December 18th. She had a very quick path to loss through a neuroendocrine carcinoma, and she was a very, very, very dear friend of mine, so forgive me if I tear up during this, but we would be remiss not to just talk about her, importance of her life, how she impacted West Virginia Health Right, and then, if we have time, we'll talk about kind of where we are today. But, she was an absolute beast of a healthcare champion, in addition to being the CEO at Health Right for 34 years, and she actually retired in 2014, and when she retired, that's when I had applied and became CEO. And then I worked for her prior to that from 1997 until 2014. So I had a lot of years working with her, but we became very close friends as well. I helped care for her and kind of served as a hospice nurse for her till the very end. And so I'm proud of myself I can get this far today and not cry. But, what an amazing lady. I mean, in addition to being the founding CEO at Health Right for so many years, she also served in the legislature. She was in the House of Delegates. She, was, I think, chair of finance. She was back in the 80s, when women were just kind of, it was just kind of the time for women to come to the forefront, and there was not a lot of women, in the legislature. So I can talk, and you can talk too about her. While we were in that, 4-week battle with her cancer, from the time she was diagnosed till the time she passed, we had a lot of time to spend time together and reflect. And she told me a lot of funny stories about her time at the legislature. And I think this one's kind of funny. We can share it now. I guess back then it was kind of old school, and the women that were in the House, there was some kind of tradition on Valentine's Day that they would go up and kiss the speaker on the cheek. And she was just mortified by that, but not me, she said, and just the way times have changed so much, you can imagine her being there. But we had a great memorial service, celebration of life service for her a week or so ago, and it was great to hear some of the stories about her. But I thought maybe we would just reflect, give her the due honor, of course, that she deserves, talk about her, things that we, some of the funny stories, some of the things we experienced with her, how she helped shape, the healthcare landscape of West Virginia, especially with those that we serve, the uninsured, and how she fought so hard for them.
She did. Dr. Cassis, Dr. Nick Cassis, he's an endocrinologist here in Charleston, and Dr. Glenn Crotty.
Yes.
They actually used to go over, and Pat absolutely was a trailblazer.
Yes, she was.
Well, first of all, nurse practitioners were kind of a new concept, and back in the late 70s, early 80s, and Pat, was hired to, she worked with the Covenant House, and she was hired to have a clinic for the uninsured, because a lot of the homeless and the underinsured and the underserved needed health care, because they would come in with infections or, different upper respiratories, and they hadn't been treated for various chronic diseases. So Pat took the reins on that. So she started in the old McMillan building that CAMC donated the space, and she worked closely with CAMC at that time, and this relationship continues now.
Right.
So Dr. Crotty actually is COO now.
Yeah, he is.
So he's a very big part of the care that patients get at West Virginia Health Right. He's a very big part of that care that they get. So going back to that time, I started with Dr. Cassis in May of '86. So he was already volunteering, and so the clinic wasn't very big.
Right.
And so Pat had mostly volunteers. And so she would call Dr. Cassis up and say, hey, I've got a patient. They had what they called the endocrine clinic. And Dr. Cassis and Dr. Crotty was part of that. So if she had a patient that had uncontrolled diabetes, overactive thyroid, pituitary issues, adrenal issues like Cushing's or something of that nature, she would call and she would say, hey, can you see this patient? So they would bring the patient actually to the office sometimes because there wasn't as much space. And CAMC again, in partnership, we would mark on the lab slip, we would order blood work, and indigent, you know, where they couldn't pay. And so they wouldn't charge us. So we would see patients a lot that way. So that's how the relationship got started.
Yeah, and well, I'll tell you, let me just add, a lot of people don't understand her background. She was a mathematician. She went to, she's from Connecticut. And the way she came to Charleston is she came down here to go to the University of Charleston, and she'll tell you, you know, she'll tell you, she would tell you if she was here herself. You know, she's very strong-willed as she grew up. You know, she was kind of hard to manage at home with her mom, Betty, and her dad, Richard. And she came down here to go to school, and she just fell in love with the state. But she studied mathematics, and then she went on to get a master's in public administration through College of Graduate Studies, you know, later turned into Marshall. But when she was here, she just fell in love with it. So the path that took her there, I mean, she really had a heart for people.
She did.
She didn't have a healthcare background, so the fact that she was picking up a phone, you know, calling the endocrinologist, you know, being an advocate for the patients, and people don't understand, that's pretty unheard of and cutting edge for somebody that's not, you know, she learned the lingo, she was able to advocate, and that just goes to show you don't always have to have this huge degree and background in medicine. It's really a heart to help people.
That's exactly right. So she was not afraid to ask.
No,
she was not afraid to ask you to help with a patient. And speaking of her background, I heard an interesting story the other day, and it kind of ties in with how Pat learned to, you know, she was able to build the foundation and to, you know, start this amazing healthcare facility that we have today.
Yeah.
But one of the ladies was telling me that her mother Betty,
Betty was special.
very strong person,
Yes, she
and
was.
she raised a very strong daughter.
Yes, she did.
And but Betty also was savvy herself. So Pat, I'm sure, sat at her knee and was able to pick up some of that savviness.
Yes.
So I was told that Betty had broken her foot, and Pat brought her up here. She was living in Florida at the time, and she brought her up here to convalesce. Well, while she was here, one of the ladies stayed with her. Pat had someone to come in and be with her. So they were talking, and so, you know, Betty was asked, well, you know, how did you get to where you are? And Betty said, well, you know, when I was growing up, and you have to keep in mind that Pat was an older lady when she passed, but she didn't look old.
No.
And apparently she got good genes from her mother too.
She did.
But anyways, her mother said, well, you know, back in my day, you know, the women ran the household. The men made the money, the women ran the household. And she said, so, you know, I wanted to find a way to make money myself. I wanted to do something. So she started investigating the stock market. And so she would tell her husband, you know, I need a little extra money, we need a tree trimmed. Or I need a little extra money, the kids need this or something like that. And she would squirrel that away. Well, when she got enough, she would invest it.
Yes.
Very savvy, watched the markets, you know.
Very savvy.
Knew the numbers.
Yes.
So she started doing that. And so then when she'd get enough money to do an investment, she'd invest it. So apparently in this, you know, in her area, the ladies would get together because most of them, you know, took care of the children, things of that nature. and they would get together and network. So Betty happened to tell them one day, I've got a little bit of money of my own. And they're like, oh, yeah? And she said, yeah. I said, I, get a little extra money, and I squirrel it away, and then I invest it. Well, these ladies wanted to do that, too. And they wanted to have a little something to call their own, too.
Yes.
And remember, this is back in a time when,
Right.
Women didn't have as much.
Right.
And they weren't as independent. So they asked Betty, said, well, can you help us since you have knowledge about the market and things of that? And Betty said, absolutely, for a fee. So she started helping these ladies. So these ladies would give her money.
Yes.
And Miss Betty would make the investment for them. And then Miss Betty would charge them a fee. So not only was she making money off the market, but she was also making...
Very entrepreneurial.
Yes, she was. She was very ahead of herself.
So I'm sure Pat learned a lot from her mother, and I called her Miss Betty. But she did, and she was a trailblazer. I mean, for sure, she was an advocate for women. If you get back and do a lot of the research, she had multiple appointments. She held some really high positions as a politician nationally, even up until her death, and I've had the opportunity since to, collect her mail and things like that at her condo. She has so many things where she supported so many causes and so many people running. It was something she was very passionate about. And I know in the recent election, in the presidential election, she made calls. She was like on a roster to make calls for people. And there was some senator out in the West that she was concerned about, and she made calls for him. And I mean, it was something she was super passionate about. But one of the major things that she's named for in West Virginia is, in the past, was pushing for the expansion of Medicaid.
Absolutely.
And things that would impact, women and children. And she never had children herself, but she was very passionate about that, and especially, health care and pursuit of anything tied to women. And anybody that you come across, I didn't have the opportunity to watch her in action when she was in the legislature. I hadn't started at Health Right yet, but I would love to be a fly on the wall, because I love to hear all the stories of how she just pushed the envelope there. And, she was serving as a CEO at Health Right when she was in the legislature. She was there for 10 years.
She was.
I think it was around, I want to say, don't hold me to this, but 83,
84.
83, 84 till 94. So that coincided with her time at Health Right, and she was able to, to do both, but it really... she used each one to complement each other, because I think what she saw at Health Right really drove her forward, in her political events and votes and everything, because she was able to speak to the subjects. And one thing about her, and I can say this from knowing her so well, she was never intimidated. She was never intimidated by anybody inside of politics. She was never intimidated by anybody outside of politics. She knew her stuff.
Yes, she did.
And she stuck to what she knew, but she wasn't afraid.
She used, she was in the political arena, and she absolutely wanted to use her position to further health care in West Virginia. Yep. So that humble beginning at the McMillan building that was a donated space eventually blossomed into a very small clinic at Smith Street.
Yep.
And there was a lot of volunteers.
I lovingly call that the double wide to this day.
Yes, that's exactly.
It's right there. It's to this day right there across from Capital Market. Yeah.
That's right. The Capital Market wasn't even there at that time. So when I started going in '93 with Dr. Cassis, people would just come in. And there was no rhyme or reason. People would come in, there was a need, they put the chart up, and you grabbed the chart and you took care of the patient.
And don't forget the paper charts. So we had paper charts.
You had paper charts. And not only that, but she was able to get drug companies and drug reps and things to donate samples. So you would see a bunch of volunteers sitting at a table, and they would be taking these samples and opening up
Yeah.
and putting them in another container and labeling them
Yeah.
so the patients could get free medication because they couldn't even afford a medication.
I first came there in '95 when I was doing my rotation at Marshall as a nurse practitioner. So you even were there a few years for me, but I know it well. In the back, we used them, and then we'd have these blue light specials, is what we called them. So we're dating ourselves here. But if we would get some kind of special in or something donated, you know, and
Exactly.
anybody was sick, you know, of course they had to be in the right treatment plan. But we'd be like, oh, you know, we got some augmentin.
That's right.
Augmentin up.
That's right.
So,
and she was very, you know, Pat was very, very much into women's health care. There was a lot of guidelines coming out about mammograms and about, you know, women's health visits and things of that nature. So she was able to network, and she was, and there was a couple other legislators that were in there and that were involved in health care. And she partnered with them.
She did.
And so they began like Bobby and Bonnie and different ones like that. And there was a
Bobby
few
Hatfield,
physicians.
Bonnie
That's
Brown,
right.
yeah.
And so she started partnering with them. And then again, there was nurse practitioners that were coming in, and she believed they were the backbone. And then she believed that the physicians that volunteered would come in and they could do the things that weren't necessarily within the scope of a nurse practitioner. So everything was donated. You know, she ran the clinic on a skeleton crew.
She did.
On a skeleton budget, but she kept adding to it, and she kept adding to it, and she kept doing everything she could. And she would go head to head with anybody. She would go toe to toe with anybody.
Yeah,
and she would
for
fight.
the patients too.
Yes, she
I
would.
remember when it would cost $1 million, $1 million to build our new building.
I remember
on Washington Street, and I remember vividly how excited we were. I remember the day that they, you know, celebrated the grand opening, and I remember how, you know, we were all told, okay, we're all gonna, people that were on staff, we're all moving this weekend. Nobody make any plans.
Right, that's right. That's
we're
right.
moving. We're gonna move this weekend, and we're gonna be open on Monday morning, and we did.
That's right, and that's Pat.
But she was there,
That's
and
right.
she wasn't afraid to get dirty, and that's something I think everybody respected about her. She had such a great work ethic.
Yes, she did.
And she, you know, she didn't ask anybody to do what she didn't expect to be done. But people always respected her.
Yes, they
You know,
did.
it's not very often anybody ever told Pat, no, I never did, because if she expected it, we were there. And that was respect that she earned, because she you know, she put her money in her work where her mouth was. She would say she was going to do it, and she'd carry it out. So
you couldn't help but like her, and you couldn't help but respect her, because the work that she was doing was so important. And there were so many people that if they didn't have health right, they would have lost their lives. There's so many cancers that has been caught at that clinic.
Absolutely.
There has so many people that has been that have prevented amputations, that have prevented complications from chronic diseases, and she expanded on that. And she started, you know, I was so excited whenever we went to the new building, because it was bigger.
Oh, yeah.
And the, you know, there was, you know, the pharmacy had changed some.
Yeah.
And you actually had a room for providers.
Yeah.
Instead of like just kind of like standing wherever you could to
I think
chart.
we had, was it 2 or 3 exam rooms in the original, I call it the original, the one that was the one across from Capitol Market.
Right, the
and it
Smith
was
Street.
so much bigger. I think we had, I don't know, 8, and we were like, wow.
Yes, everything was bigger.
Everything was bigger.
Yes.
We thought we would never, ever fill that building. I remember the first, the beginning, we just had the bottom floor, and the top floor was totally empty. And then, you know, over the years, she helped add the dental clinic. And then, you know, by the time that I took over as CEO, we basically, we built the rest of that building out, and all that growth and the foundation. And I always, you know, and I tell people, she taught me everything about being a CEO, about, you know, at the time, you know, being a woman in a very male, you know, oriented arena. Most CEOs, there's not a lot of CEOs that are female. How to go into a boardroom and handle that. you know, how to go in and advocate for patients and ask for things, and how to, you know, talk to politicians and, you know, advocate for the clinic and all of that. She taught me all that. She also taught me when it was time to get up and leave a meeting, when she didn't like what they were saying. I'll never forget, we went to a meeting and we were trying to do something for the patients, and this is when I was her clinical coordinator. So I had, you know, advanced and was a clinical coordinator, so I answered right under her and dealt with a lot of the clinical stuff. And we would go to meetings, and we went to this meeting, and she was trying to tell them what we needed for the patients, and they weren't like, she said, Angie, get your purse, get your coat, we're done here. I'm like scrambling. That was her. I'm like, okay, we're leaving.
That's right.
And she, you know, she knew when to, you know, take a stand, and it was great. We did that multiple times.
Yes.
And it was on behalf of patients. I personally heard her call all over town. There was a child that was in a kind of in a gap area with Medicaid. They were on a tube feeding, and for some reason it wasn't covered, and the mother was just reaching out. You know, when you have a child like that, and you know, they have to have that to live. You do just about anything to get it. And she'd called seeing if there was some way, you know, that we could help her. And Pat was, you know, making the calls. Of course, she found some for her. But then she was trying to fix the problem. She was calling everybody, you know, tied to the program and Medicaid, you know, like, this has to be fixed. You know, this is not going to do. And she was just like a bulldog.
Oh, absolutely.
She was a bulldog.
Well, you know, and you bring up an interesting point where she was a mentor, because I started there in '93 as an REM, and then, you know, Dr. Cassis and I had a conversation about me becoming a nurse practitioner.
Yeah.
And Pat also helped to groom me, as well as you did, because when I was in graduate school, I went to Pat and I said, Pat, you know, do you mind if I do my clinicals here?
Yeah.
And she said, well, right now Angie's busy because, you know, she's a clinical coordinator, but you are the only student that we'll accept right now. And so that was an honor to me, that she and you accepted me. So she groomed me, and as well as you did. And so I was able to actually do my capstone project there, because not only did we have health care that we offered, but there was a lot of support groups. There was the smoking cessation. I think they called them the puffer snuffers.
Yep, that was the name.
That's exactly
right. Puffer
right.
snuffer, because they had the little logo with like a little dragon and the smoke, and it, you know,
exactly
snuff out the
That's
smoke.
right. So I would teach that. You know, and of course that was during the time you were having your, you know, some of your family.
Kids.
That's right. And you had the twin girls. And so, you know, so Pat was always very gracious.
She was.
Whatever hours I wanted to work, whatever I needed, you know, she was
really
always there to try to help. So not only did she help patients, but she helped other nurse practitioners or nurses or employees.
She was a big proponent of nurse practitioners.
That's right.
And I mean, even as it stands today, we have all volunteer physicians and dentists. But it's you know, I'm a nurse practitioner with a doctorate. You know, with a nurse practitioner led clinic.
Right.
And she really laid the groundwork for that, because she only, as far as I know, I mean, historically, she typically hires nurse practitioners, and then, of course, the dentists, you know, we said the physicians are volunteer. Of course, we love, you know, PAs, they got an important role, but historically, it's been a nurse practitioner.
That's exactly
ran
right.
clinic, and she was a big advocate anytime there was anything politically, as far as prescriptive authority or anything like that that was involved. She never hesitated, you know, and it was great because she was able to tell the story about how important they were in her clinic, how important they were in practice. And I think, if I'm not mistaken, you know, like Barb Coster, we love her. She's one of the very first.
Absolutely.
She's an adult nurse practitioner.
Yes.
And she practiced there. And there were other people as well that I can't remember all the names. But a lot of the early people, some of the first people that were nurse practitioners in the state, practiced there. And Pat was a big advocate. And I think she really propelled the profession forward as well.
Oh, absolutely. I remember Alveda,
yes.
and Mary Nemeth Piles, and they were excellent preceptors and educators. And I remember we went to the Capitol. Earl Ray Tomlin was governor.
Governor Tomlin.
And there was, you know, we were up for prescriptive authority. And unfortunately, you know, we're nurse practitioners, and Pat had utilized their care for years and years and knew the importance of our contribution. But Governor Tomlin at the time didn't understand. And so we had to go to his office. And Pat was one of the people that advocated for prescriptive authority. And I remember her being there at the Capitol. And I remember all of us going into Governor Tomlin's office and explaining to him what we did and how important it was, and how sometimes physicians can't get to those areas, or they have other things that, you know, specialties and things like that. But the nurse practitioners, you know, were there, and we needed to have prescriptive authority.
Absolutely.
And once we explained that to him, it was passed.
Yeah, it was.
And,
so, I mean, it's far.
And
it's
it was trailblazing.
Yes, it was trailblazing.
And
for women, for healthcare, for the profession of nurse practitioner, for healthcare in general, like she, you know, West Virginia Health Right, we now have 45,000 patients. We're the largest free and charitable clinic in the state, and it was the very first free and charitable clinic in the state. And the whole concept of utilizing volunteers and how we were able to, you know, get medications and the whole system, that was all her design.
That's right.
And then since then we have other free and charitable clinics in the state. I mean, we could go on and on. She was she helped start the State Association of Free Clinics. She helped start the National Association of Free and Charitable Clinics, and she served as president until they were able to hire Nicole Lamoureux, who had an emergency and wasn't able to come in for Memorial. But you know, she loves Pat because she actually helped, you know, interview her and hire her. But she's laid all that groundwork, and sometimes even for us, you know, she was my friend. I loved her. It's easy to forget. Well, not easy for, she's not easy to forget, but when you're there with her, and she's, you know, she also had this soft side. She loved animals. She's very passionate about animals, and you know, I called her the animal whisperer. She had a place in Michigan, and back behind the house, she had these little chipmunks she would feed out of her hand, little nuts and stuff. She was so, and I knew that she personally paid for people to have their animals treated at the vet because people maybe didn't have the means, and she had such a heart for that. She personally donated. I could go on and on and on. We're running out of time, but she's just a great person.
She was.
From one end of the spectrum to the other. She had a hard side to her when she needed to be, and she had a soft side too. But
she was funny, and she was larger than life.
Larger than life.
And she was very animated and a snazzy dresser.
Yes, she was.
I used to love some of the outfits that she wore.
And she did it her way right till the end, I'll tell you. You know, she may have had cancer, but my favorite thing to say is she had cancer, but cancer never had her because she called the shots till the end.
She did it her way.
She did it her way. But I just wanted to pay homage to her today.
Oh,
I mean,
absolutely.
because we're running out of time. We got about a minute here, but she absolutely laid the groundwork for everything that Health Rate is today. We've taken it. You know, when I took over, we've ran with it. It's grown leaps and bounds.
Yes, it
But
has.
she taught me all the tricks of the trade and how to do things. And we've, you know, and it was great. You know, at the end of her life, she told me how proud she was of me and, you know, Health Right. And so I feel good knowing that we're carrying on that legacy. So every day that we do everything at Health Right, in addition to helping people, doing the right thing, doing what we should, it's always also to honor her.
That's right.
And her legacy.
Absolutely.
But I want to thank you, Alice,
You're most
for
welcome.
coming on. I always enjoy talking to you. We could have you come back and talk about diabetes and all these other things, but it's just great to have somebody that knew Pat as long as I did to just sit down and talk about how great she was. So
she was a model.
Yeah, I encourage you, if you don't know about Patricia Holmes White, Google her in the state of West Virginia. She did some amazing things, and we'll forever be indebted to her.
Absolutely.
Thank you, Alice.
You're welcome.